Your patient becomes uncooperative, and you decide that it is in your best interest to deploy soft restraints to protect you and your patient. Is this what it looks like in your ambulance as you attempt to restrain an uncooperative patient? Hi, my name is Jason from DT4MS, and in today's video, we're going to discuss patient restraints. Did you know that attempting to restrain an uncooperative patient is one of the leading causes of injury to healthcare providers? On average, pre-hospital care providers get between 0 and 4 hours of training in how to and when to restrain an uncooperative patient. The huge flaw to this is that usually none of these hours are in the actual physical restraint process. That being, how do I get the uncooperative patient to our cot and restrained? Per OSHA guidelines, it takes 5 trained providers to safely and effectively restrain one uncooperative patient. That is 1 provider for each limb and 1 provider dedicated to the head to monitor the airway and ensure no one gets bit. What we have learned is that there are several major failure points in the restraint process. These being, first off, not having enough trained providers on scene with adequate training in the restraint process. Having to go back to the truck to find restraints when you need them. Not having dedicated restraint devices and attempting to use things like triangular bandages, rolls of Curl-X, or even sheets. The use of unsafe securing points on the cot, like tying someone off to the arm rails, the IV pole, the cot's pivot points, and even the lower carriage. So what's the solution? We have found a product that helps to eliminate a multitude of these failure points, and it's called XD Cuff. XD Cuff is the first stretcher integrated restraint system designed by a paramedic with EMS provider safety in mind. So, what is so great about the XD Cuff system, you ask? The simple yet effective system securely mounts on the cot on the frame underneath the mattress until needed. By simply unhooking a Velcro closure, the restraint deploys out and are easily labeled with which extremity they are intended for. Simply place the cuff around the person's wrist or ankle and grab the red pull tab and pull tight. By using the XD Cuff system, you will be able to restrain faster, safer, by eliminating the need for searching for your restraints. Finding anchor points, and trying to tie special quick release knots that often fail. XD Cuff has not paid us to talk about their product, but it is a restraint device that we have found to be quick, effective, and increase patient and provider safety. If you would like more information about XD Cuff, visit their website at www.xdcuff.com. And if you mention DT4MS during your order, you'll receive a 10% discount. If you learned something from this video, please hit that thumbs up button and consider subscribing so you don't miss any of our other videos on pre-hospital care provider safety and product tutorials. Until the next video, be safe.